Good afternoon, everyone. Thanks for tuning back into my channel. I'm Nakia, and today is going to be a very different kind of video. I got a request from one of my subscribers because she's getting ready to start doing clinical soon. So this video, I'm going to give you a few tips on what to do in clinical and what not to do in clinical. Excuse me. So if this is your first time tuning into my channel, I would like to say first, thank you and welcome to my family. And if you are a frequent subscriber and you see all of my videos that I upload on a weekly basis, I would like to say thank you for returning again. All right, so since my don'ts are much shorter than my do's, I'm going to start with the don'ts first. So the biggest don't in clinical, what you should not do is sit down. Do not sit down during your clinical. Unless you are maybe filling out some paperwork, you have some downtime, your patient is clean, she's fed, you've done all of your morning vitals or afternoon vitals, you've collected your input and output, everything is documented. If that is done and your patient may be asleep, then you can sit down and start on your paperwork. But unless you're not doing that, do not sit down, guys. That's the worst thing you can do in clinical. Do not let your clinical instructor or other people around you that are staff there, don't let them see you sitting down, because that kind of makes you look bad, and it makes your instructor look bad as well. Another don't, do not be afraid to ask questions, or do not be afraid to do an assignment on a patient. If you have not completed that assignment before, or you don't know what it is, then let that person know, okay? I will be more than happy to help you, but I will let you know that I've never done this before. So if I can watch you, or if I can just be in the room to help assist you with anything that I can, then I can do that. But guys, do not be afraid to do anything, unless, it's out of your scope or you've never done it before. But just don't be afraid. Don't let them see you afraid, because I know when you start clinical, it can be a scary experience. But unfortunately for me, I've been in clinicals 1, 2. This is my third go round of being in clinical. So I feel comfortable. But there are times, especially when someone has a colostomy bag or has some kind of ostomy, I haven't dealt with that a lot. So if I could just go in with another student or just be in the room when that care is being done, then, that's a great experience. But just don't be afraid to do anything in clinical. This is your time to learn. This is a great learning experience. So when you are finished with school, you can be like, oh, I did this in clinical. So, everything will come back to your memory, and, you can tackle that job. My last don't is don't be a know-it-all. Even though I said, this is my third go around in clinical, if there is something like, especially with calf care, I've done a lot of calves on pediatrics, not a lot on adults, but with pediatrics, I do know how to insert and remove a catheter, but with adults, no. So what I do, I like to go in and see it done. And if I have questions, I can ask them later, but do not be a know-it-all during clinicals, because it doesn't make you look good, guys. Okay, let's get to the fun part. Let's get to what you should do in clinical. And my first one, I have talked about this in one of my previous videos, and I will link that above while you are watching this video, but be prepared. And what I mean about that is, okay, for instance, my clinical is on Thursdays this semester. So what I do on Wednesday nights, I would go in my closet behind me and I will go ahead and lay out my uniform. That includes my top, my bottoms, my jacket. I have my shoes laid out. I have my badge right beside my uniform. If it's not beside my uniform, it's in my bag here. And I have my bag here because I'm going to show you some things in just a few. But being prepared the night before is so beneficial, so that you will have a great, productive clinical day. Something else, print out all of your necessary paperwork. And for me personally, my instructor, she's the greatest. She has all of our papers besides just one thing that we may have to print out, and that's our weekly feedback tool. But everything else that we need, she brings it to to clinical each Thursday so that we will have that. Also, little things like a pocket-sized drug book. And all of this is detailed in that video that I will have linked above. But a pocket-sized drug book. This is so cute, guys. Look at it. This is the 2022 Lippincott. And I think I had this in my nursing supply haul video. And if you haven't watched that, I'll link that down below too. But this, look at the size of it. I mean, it literally fits in the palm of my hand. But this is something that can fit in your scrub pocket. That's good to have. Pen light. Please, 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 you cannot complete a full head-to-toe assessment without your pen light. And disclaimer, let me show you the pen light that I have because I'm getting a lot of, I'm getting some feedback on the different types of pen lights that you need. Do not go out here and get a pen light that is bright. No. Get a pen light that is warm. You see? It's not that bright in my hand, if you can see it. And if I flash it, you know, it's not that bright. But this one, and it came in a 2-pack. But get the one, if you have to search it, search for a warm pen light because the warm light does not hurt your patient's eyes. And I can literally do that in my eyes and I don't feel anything. But when you shine a really, really bright light in someone's eyes, that hurts. So guys, Amazon, it's a 2-pack. Search a warm pen light. And that one was like a rose gold and the other one is white. That one might be a little bit brighter than the other one, but both are warm. So it's not that hard on your patient's eyes. All right. Come prepared to clinicals with bandage scissors. Especially cutting open that thick, tough IV bag. Some you can split down the side to open. Others you have to cut. Bandage scissors. Please, guys, please come prepared. Of course, your stethoscope. That's a no-brainer. I have my own pulse ox. I use this a lot because when it comes to taking your vital signs, if that pulse ox is messed up on your Dynamap, you know, that's not an accurate head-to-toe assessment because you don't have your patient's pulse along with the oxygen. So guys, you gotta be prepared. Roll of tape is good for when you are hanging up your IV bags or when you're doing wound care. You gotta initial it. Put your put the time it was done. Put the date it was done. Roll of tape. I'm sorry guys if you hear my husband in the back. He's so loud. But a roll of tape is good. So stethoscope case. Amazon, I got this to hold everything I need. So really guys, I can just go to clinical with this and my clipboard that holds all of my papers. And on Wednesday nights, I'm pulling this bad boy out and I'm putting all my necessary papers in here that I need for the next day. So guys, just being proactive, you know, having everything laid out the night before. So when you get up that next morning, pumped and ready to go to clinical, you got everything laid out that you need. Oh, go ahead and pack your lunch the night before. Now, I'm not a huge lunch taker to clinical because the hospital that we're in has some good food. So I treat myself, you know, on Thursdays and I buy lunch in the cafeteria. But if you're not that type of person that like to buy your lunch, pack your lunch. Put everything that you need in the refrigerator, you know, so that way when you get up in the morning, all you got to do is just grab your lunch bag out of the refrigerator and head on out the door. A watch, guys. Now, I know you see me always wearing my Apple Watch. Now, we are fortunate enough to be able to use an Apple Watch. And as you can see, I'm already on the secondhand screen. So if you got a watch that has the second hand, that's what we have to take in clinicals. Or if you got your Apple Watch, make sure your screen is on the second hand clock. Okay, so that's all for like necessities that you need for clinical. Please, I can't stress it enough. Just be prepared the night before and it will just make your clinical day run so much smoother. All right, another great tip. You want to look presentable, you know, have wrinkle-free uniforms, you know, nice clean shoes. You don't want to go to clinical shoes all busted up, you know, they got dirt on it, they got mud on it, you know, God forbid whatever else could be on your shoes. But come on guys, this is like you're prepping for really your interview once you get out, because you never know, you might want to start in med surg or, you know, long-term care. But wherever you're getting that experience, just treat it as, you know, a job that you can go to once you're finished. So you want to look nice. Please, a big do, ask questions, you know. I can't stress this enough, because I'm the type of person, if I don't know something, if the patient asks me a question and I'm not sure, I'm not scared to let them know, hey, I don't know, but I'm going to write it down. I'm going to write your concern down, and I'm going to come back and I'm going to have the answer for you. And they feel better when you tell them that versus saying, I don't know. You know, true, we are nursing students. We're not going to know everything. But when you let that patient know that you are trying to find out her answer, she will respect you for it. Be proactive. Please, 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 please be proactive. You know, if you are all caught up on your work, everything is documented on your patient, go and help another nursing student. They may have a much larger patient, you know, that's going to need more people in the room to turn her or, you know, to bathe her, anything like that. Help others. Don't just be standing around like, yeah, I'm finished. I don't have nothing else to do. I can just sit here. No, you can't. No, boo-boo. You got to go and help. You need to go and do other things, you know, because this is, like, again, like I said, this is a time where you're going to get your experience. You're going to let them know that you are open and willing to, you know, help, you know, to be of assistance. Okay. This should have been number 2 after I said prepared, but arrive early. Okay, so my clinical on Thursday starts at 6 o'clock. Every Thursday, I arrive about 5:35, 5:40. Okay, I sit in the car, collect my composure, say my daily prayer before I even step inside. All right, I get my bag, I'm walking in the door, so I'm signing in at 5:45. That's just me. Have you ever heard the saying, like, when you get there on time, you're late? Okay, so point taken. Please arrive early. Arrive 10, 15 minutes early. Hey, 30 minutes early if you want to, you know, just to collect your thoughts, breathe, relax. Because I know when I go in, sometimes I'm feeling like my shoulders are always up. That way you can just breathe, you know. And I know this might sound funny, but hey, I know there's a lot of people out there that goes to clinicals with their shoulders up, you know, because I can see it, you know. But when you arrive early, you collect all your paperwork from your instructor. Start working on some of the things early. That way, when your instructor says, okay, guys, it's time for us to head on upstairs, you're ready, you know. Okay, please, another do, report all abnormal vital signs or anything that's going on with your patient. Please report it to your instructor, and please report it to the nurse that the patient is assigned to, you know. Like, say, for instance, this past Thursday, my patient's blood pressure was elevated. So what did I do? First, I documented it. Second, I told my clinical instructor. And third, I told the floor nurse. So that's 3 things that was documented on that patient, you know, that was abnormal. Or 3 people that were, or actually 2 people, because, you know, once you document it in the chart, the floor nurse does see it. So report anything that's abnormal. You know, when you first come into the room and you're assessing the room, making sure there aren't any cords or rugs or anything, or it wouldn't be rugs in a hospital, but if you're in a long-term care setting, make sure there's nothing in the way of where that patient, if she's mobile and she can get up and walk to the restroom, make sure there's nothing in the floor to where she can trip up on and hurt herself, you know. Okay, be professional. Please be professional. I can't stress this enough, you know. I mean, I know sometimes you might see one of your classmates in the hall and you be like, hey girl, how's everything going? Yeah, you can do that. But guys, you know, don't sit there in the middle of the hall and carry on a conversation, because, you know, there are open rooms beside you and they're noticing everything and they're reporting it. So guys, just be professional. If you have to discuss about something that's not clinical related, do it in a softer tone, or go in an area where no one can see you. And my last do is smile and have fun. You know, clinical, it can be stressful, it can be intimidating, you know, it can be all those things. But clinical can be fun too, guys, you know, because at first when I began my journey in in August of last year, and we started out at a long-term care facility, I had already made my mind up before I even stepped inside the building that long-term care was not for me. But now, guys, I think that it is. Once I'm done, you know, I'm still going to have my full-time job with pediatrics, hopefully. And then, you know, I want to do PRN at a long-term care facility because that's where I'm going to get a lot of my experience. Because in my pediatric clinic, I've already mastered that. I've been there in August, it will be 6 years. So I know everything, but there are going to be some more things to do once I graduate and take the NCLEX. There are going to be a few more skills that I can take under my belt. But yeah, I think long-term care is where I really want to be. And I've been watching a lot of other, YouTubers, and they're just giving me so much life and so much, you know, things to expect from long-term care. I was like, yeah, this is what I want to do, you know. And so, guys, this was just a quick and fun video to make for you guys about the do's and don'ts of clinical. And if you have any other suggestions or any other good ideas that you would like for me to talk about, please list those down below and in the description box, and I will be more than happy to do that. Now, I have another request on how to do a concept map, and if everything works in my favor, tomorrow I will try to do that, and I will use my whiteboard, and I will demonstrate how I do my concept maps. Now, I haven't done one in about 2 exams. You know, my last 2 exams, I didn't do a concept map, but I can easily pick up my book and pick a disease that we're doing, and I can easily do it on my board for someone. I mean, I know if you are a visual learner, you would love concept maps, because instead of actually writing things down on paper or typing it up in a study guide form, you can actually do it on a whiteboard, and it can be fun, guys. So if you enjoyed this video, please hit that like button down below. And if you are not subscribed, please hit that subscribe button and share this video if you will, because I'm pretty sure there are tons of students who are getting ready to start clinicals. And I know there are a lot of students who are already in clinicals. So some of these tips may help them while they're in clinicals. And I know it will be a blessing to someone who's getting ready to start clinicals. So guys, if you like this video, again, hit that like button and make sure you turn on your notification bell so that you will be notified as soon as I upload a video. So guys, until next time, be blessed and be safe. Bye-bye.